Hello everyone, I hope everyone is doing well. This is Dr. Mona Abdurrahman and I'll give you the English course. Our focus in this course will be on the medical terminology that you will use during your study. This is our first lecture. We will take today the medical terminology. Medical terminology is language used to describe anatomical structures, procedures, conditions, processes, and treatments. When you divide any medical terminology, or most of the medical terminologies, you will find a fixed structure. A fixed structure. Most medical terminologies are consist of prefix, root, and suffix. Prefix, the beginning of the medical terminology, root, the middle, and suffix, the end. When you study and memorize these prefix, root, and suffix, you will be able to understand many medical terminologies. Let's take an example. For example, this large twisting word, pneumono-ultramicroscopic silicovolcanoconiosis. This is a really large word, but when we divide this word and break it into its components, it will be easy to understand it. For example, we have pneumono means related to or pertaining to respiration, breathing. Ultra means small, very tiny. Microscopic means tiny as well. Silico comes from silicate. Volcano from volcano. Coni means dust, and osis means condition. So the meaning of this large word, when we divide it like this into its components, is a lung disease caused by the inhalation of very fine, very tiny silicate dust originating from the eruption of a volcano. So this word refers to a disease that comes to human beings when we inhale, when we breathe in a very fine and small dust that comes from the eruption of volcanoes. All right. These two words, they may seem very similar in spelling, but they have very different meaning. They have actually opposite meaning. Hyperglycemia and hypoglycemia. Hyperglycemia means high blood sugar, and hypoglycemia means low blood sugar. So we have the difference between hyper and hypo, high and low. So as we said, the basic structure of the word is prefix, root, and suffix. Prefix, when included, the prefix appears at the beginning of the medical term, all right, and usually indicate a location, direction, type, color, quality, or quantity. The root gives the term its essential meaning, like, for example, when I say cardio, cardiology, cardio, biology, bio, all right? These are the roots of the word, cardio and bio. Nearly all medical terms contain at least one root. When a prefix is absent, when there is no prefix, the term begins with a root. Suffix, the suffix appears at the end of the term. at the end and may indicate a specialty, test, procedure, function, disorder, or status. Otherwise, it may simply turn the word into a noun or adjective. We will have examples on all of this on the prefix, root, and suffix. These are just the definitions. Combining vowels. We combine in most of the medical terminologies the root, for example, or the prefix, the root and the suffix, they are combined by a vowel. This vowel is O vowel. Like the example that I said, cardiology. Cardi means heart or cardio means heart. So the vowel O, what is the function of the vowel O? The vowel O is used in order to combine between card, cardi, and logy. So cardiology, right? So breaking a word down, when we break the word down or when we divide the word to its component part, this helps the reader to determine the meaning of the term. When you start to memorize the meaning of the prefix, the meaning of the root, and the meaning of the suffix, you will be able to understand many medical terminologies. This is why I wanted to give you the prefix and root and suffix in the first lecture. Because it will help you in your study. Whenever you find a long medical terminology, you can divide it and understand it. Like, for example, hypothermia. Hypothermia, hypo, we said that it means below. Therm means heat or temperature. And ia means condition. So when we say hypothermia, here you can notice the vowel O. Hypo. Hypothermia means the condition of having low body temperature. We have hypo means below the normal, right? Therm means heat or temperature, and ia means condition. So it is a condition of having low body temperature. All right, we have another example. We have this example, transesophageal echocardiogram. Which is abbreviated to TEE, all right? Let's divide this large words. We have transesophageal. Trans means this is the first part of the medical term. Trans means across. Esophageal, referring to the esophagus. And we have eel, which means related to or pertaining to. Echocardiogram, we have echo, referring to sound, cardio, which is the root in the middle of the word. Cardio means heart, and gram means picture. So, transesophageal echocardiogram is a test that uses sound waves to create high-quality moving pictures of heart and blood vessels. All right? Why We have esophageal because the tool, the probe, is placed through the mouth into the esophageal, into the esophagus, right? So again, trans means across the esophagus, yeah, meaning that um, across the esophagus, you see this picture. Uh, we have across the esophagus, we are able to picture the heart through using sound waves, all right? So let's see here in this page the word roots of the body. A root is the fundamental element of any medical term. Roots often indicate a body term or system. So we have, for example, for the head, we in this part will divide the roots into roots related to the heart, the head, heart and circulatory system, bones and muscles, digestive system, and we will have other common roots. So for the head, we have encephalo, meaning brain, like electroencephalogram. We have cephalo, referring to the head, like cephalic. When we say cephalic, the suffix ic means pertaining to. Pertaining to means related to. Pertaining to means related to. A cephalic presentation describes a head-first position for the delivery of an infant. So when we say that this is cephalic position, it means that the baby or the infant head is down. All right. Ot or referring to ear. Tympan referring to the eardrum. Ophthalm or ocule referring to the eye. Facie referring to the face. Rhino or rhine referring to the nose. When we say rhinitis, it refers to the inflammation of the mucous membrane of the nose. Crani means skull. Lingo means tongue. Odont or dent means tooth. You will find here this column is for the examples. I encourage you whenever you find an example for these blanks, you write it. I wrote some examples and you can, in the exercises that we will take after that and in the example that you will take, you can write these examples in the blank. So we have here rhine or rhino means nose, nose like rhinitis. Crani means skull. Lingual means tongue. Odont or dent means tooth. We have the heart and circulatory, like for example, aorta means aorta. We have arterial referring to the arteries. We have hemo or sango referring to the blood, like for example hematology, or hema here means blood. Entology means the study of. So hematology means the study of the blood. We have hemoglobin. Uh, as we said, hemo means blood and globin means protein. So hemoglobin means the cells that carries oxygen in hemoglobin carries oxygen in red blood cells. We have vascular or vasculo means blood vessels. We have cardi or cardio means heart, like cardiology. We have vein or flip means veins. For the bones and muscles, we have brachy, means arm. We have dorsum. Dorsum is for the singular, and dorsa is for the plural. In Latin, the plural form of any word that ends with um is a, right? So whenever you, for example, this is in Latin, whenever you find a word that, like, for example, this dorsum, it ends with this is turned into a in plural, right? And this is in singular, right? So dorsum or dorsa, referring to the back, osteo, referring to the bones, like, for example, osteoarthritis. This is a condition of aging. We have arthritis here means the inflammation of joints, right? And osteo means bones. This word, this medical terminology means the condition of aging. This is a condition of aging, and it's actually a degeneration of bones and joints, but it's accompanied with inflammation. So let's take it again here. Let's divide it again. We have this word. We said that osteo means bones, and arthur means joint. Iris means inflammation. Here are three actually. So when we say this word, it's not the inflammation of bones and joints. No, this is a condition of aging when the human beings are of old age. What happens to them? This osteoarthritis is a condition when the bones are degenerated, when they become weak. All right, and this is accompanied with the inflammation in the body. So let's go back. Pod or ped, foot; tal, ankle; myo, muscles; coast, rib; scapule, shoulder; carb, rest; arth, joint. Or artery, like the word that we said before, arthritis. For the digestive system, we have append, referring to the appendix. We have colon, referring to the colon, the large intestines, and we have esophagus, or here we have esophag. When we have the letter O in the beginning of this word, we have two spelling for this. starting with the E, all right? And this is the American spelling, or starting with the O, and this is the British spelling. This is the prefix, all right? Referring to the word itself, esophagus. So we have here esophagus with the O or the E. Again, this is the British spelling, and this is the American one. Enter intestines, but the small one, usually the small one, like the enteritis. When we say enteritis, it means that the inflammation of the small intestines. The small intestines enter is narrower but much longer than the large intestines, which is the colon. Ren or nephro means kidney. Ren is a Latin word, right? And nephro is the Greek one. They both means in medical terminologies, they refer to the kidney, all right? But the ren, it comes with the L, all right? Renal. We have ren and nephro referring to the kidney. Ren is a Latin word, and nephro is the Greek one. Both of them, they refer to the kidney. Ren is used with AL. We never say with nephro is never add AL, but with ren we add AL. When we say renal, it means related to the kidney. All right, when do we use nephro? We use nephro with other suffix, such as osus, all right, iris, and ectomy. We will take the meaning of these suffix later. All right, they describe the abnormal conditions and operative procedure. These three suffixes, they describe procedures related to the kidney. And we will take them, as I said, later. Hepato means liver, like hepatitis. We have gastro means stomach, like gastrotomy. We have rectum. We have periton, referring to a membrane lining of abdomen and pelvis. We have other common roots, like, for example, neuro, referring to the nerves, in, like, for example, neurology. As we said, neurology means the study of, so neurology means the study of nerves. We have plum, referring to the lung, or plumon, referring to the lung. We have derm or dermat, referring to the skin, dermatitis, inflammation of the skin. We have carcin, referring to cancer. A carcinoma is a cancerous tumor, because oma is a suffix referring to tumor. So when we say carcinoma means a carcinous tumor. Chem, drug. Electricity, like for example in electrocardiogram. We have therm, heat. The root nous means knowledge. So in diagnosis, we have the prefix dia. Dia means complete. And as we said, nous means knowledge, and osis means condition. So the literal meaning of this word is the state of complete knowledge, a state of complete knowledge. And of course, the general meaning means that when we have sufficient information about a patient, in order to know what does this patient complains about. We have bio means life, like in biology, the study of life. We have bar or tension means pressure. We have echo means returned sound. Aden means gland, like in adenoma means tumor of a gland. As we said, oma uh, means this suffix means tumor, and we have cis to cut, like incision. Kren means to secrete, to form and give off. So when we say endocrine glands, the prefix endo means within. So endocrine glands means to secrete hormones directly within the body stream. Other glands are called exocrine. Exocrine glands, they release their secretion outside the body, outside the body. We have glyco, means sugar, as we said in the beginning of the lecture, hyperglycemia and hypoglycemia. All right. We have ger or geru, means old age. We have Gynea means woman or female, like in gynecology, and we have ped means child, like pediatric. We have onco means a tumor, like oncology, the study of tumor. We have psych means mind, like in psychology or psychiatrist. Here we have a quick picture of some of the roots. You can use it in memorizing the roots. All right, sometimes we have words that consist of more than one root. Like, for example, in cardiopulmonary, which means pertaining to or related to the cardio, the heart, and plumo, which refers to the lungs. All right, we have, for example, gastroenterology. Gastroenterology means the study of stomach and intestines. Uh, as we said, we combine between the prefix, root, and suffix in most of the time by using the vowel O, like, for example, neurology. So this part that we have taken was related to the roots, and as we said, most of the roots are means or refers to the body parts. Here we have the prefix. A prefix modifies the meaning of word root. It may indicate allocation, type, quality, body category, or quantity. The prefix is optional and does not appear in all medical terms. Sometimes the word starts with the root, all right? Not all of the medical terms start with a prefix. Some words start with the root. We have prefixes that refer to the size, like macro or mega means large, and micro means small, like microscope. We have prefixes referring to the number, like semi, half, hemi, half, or also we have mono and uni, one. We have bi, means two, tri, three, and quadra, four. Equi means equal, holy means many. For the level, hyper means above normal, like for example, hyperthermic means above the normal body temperature, and we have hypo means below, like hypothermic, below the normal body temperature. We have eu or normal means normal or good, like euthermic. Before continuing in the rest of the prefixes, let's look back and let's have a quick exercise over what we have taken until now. For example, we had the root gastro. Gastro, what is the meaning of gastro? Or what does the root gastro refers to? It refers to the stomach. What about nephro? Nephro refers to the kidney. Hepato. Hepato refers to the liver. Neuro refers to nerves. Myo refers to muscles. Cephalon refers to head. And as we said, encephalon refers to the brain. Enter refers to the intestines. Holo refers to colon. Scapula refers to shoulder. And cis means to cut into. So let's go back. This was a quick refresh to the information we have taken. Let's go back to the prefixes. We have prefixes that we have taken the prefixes that refers to the size, to the number, and to the level. And now we will take the prefixes that refer to time or speed. We have post means after, be means again, and retro means back or backward. We have pro, pre, and anti means before, and neo means new. Chron means time or long time. Brady means slow, like bradycardia, and which means slow heart rate. Bradycardia means slow heart rate. Let's divide this word. As we said, brady, this prefix means slow. All right. And we have cardio or cardi means heart, and ear means condition. So we have brady means slow, cardi means heart, and ear means condition. So bradycardia means the condition of having the condition of having slow heart rate. It is a condition of having slow heart rate. And we have the word tachycardia. So we tachycardia means the condition of having a fast heart rate. So the condition of having fast heart rate. Direction or position, we have ab means away from, ad means toward, supra means above, peri, epi, circum means around, like pericardium. Pericardium is double-walled sac containing the heart and roots of the great vessels. Again, what is the meaning of pericardium? Pericardium means double-walled sac that contains the heart and the roots of the great vessels. Peri alone means around, and cardio means heart. All right. So when we say around the heart, what is the meaning of around the heart? It's a sac, all right, that contains the heart and the roots of the great vessels. Trans means across, inter means between, endo means within or inside, exo or ecto means outside or out of, auto means self, dia means through or completely, like in diagnosis, and con means together, sub means below. These are some words that refers to the direction and position, and they are not, they doesn't consist of prefix, root, and suffix, but you have to take them because you will find them a lot in the medical terminologies. In anterior or ventral means at or near the front surface of the body. And some dictionaries refers to it as relating to the abdominal, the stomach, the abdominal. Posterior or dorsal, we said that dorsa or dorsum means what? Means back. Dorsa means back. Do you remember? So when we say posterior or dorsal, it means at the rear surface of the body. What is the meaning of rear here? Rear here means behind. All right. So it's situated behind. All right. Superior means above. Interior means below. Lateral means side. Lateral means side, like the lateral aspect. Distal means farthest from the center, and proximal means near to the center. So we have distal, the opposite of it is proximal. All right, let's go back to the prefixes. As we said, these are words that means or refers to the directions. You see, these prefixes refers to the direction and position, all right? In this table, we have words that refers to the directions and positions. So I wanted to give you these words under the prefixes in order to memorize it because you will find it in many medical texts. Let's go back to the prefixes. You will find prefixes that refers to the function or quality, like in Anti or contra means against. Mal means bad. Iti means cause. A or D. A or D means without. This means not working correctly, like dysfunctional. Dysfunctional means not working correctly. Some prefixes refers to the color. Some prefixes refers to the color, like chromo means color, and erythro means red. So when you say erythrocyte, means cyte here means cell. Cyte means cell. So when we say erythrocytes, these are the red cells. This is the literal meaning. The red cells. They carry oxygen in the blood. We have leuco means white. So when we say leukocyte, the literal meaning of leukocyte means white cells, white blood cells. The leukocyte, this blood cell, helps the body fight against disease. We have cyano means blue, we have chlor means green, and we have melan or milano means black. Other fractal means addition of artificial part. This is about the prefix. As we said, the prefix are related to color, related to size, level, and so on. Let's go to the suffix. As we said, suffixes comes at the end of the medical terminology. They come at the end of the medical terminology. Like, for example, itis means inflammation, all right? And ectomy means removal, all right? Alternatively, the suffix may simply turn the word into noun or adjectives. Sometimes, when we add, for example, when we say kind, right, and then we say kindness. So here, what is the meaning of, or what is the function of the suffix? It turned the adjective into noun. Again, when we say, for example, kind, right? This is adjective, right? And when we say kindness, this is the noun form. So here, the suffix may turn the adjective into noun and sometimes the noun into adjective. The ending a, e, and as are commonly used to turn a word into a singular noun, like as we said before, is the singular form and us is the plural form, like in dorsum and dorsa, all right? Okay, let's see the basic noun and adjective suffix. Like genic means causing, like carcinogenic. Carcinogenic means causing cancer, right? So when we say cigarette smoke is carcinogenic, means that the cigarette smoke cause cancer. We have ia, ism, cis, and the y means condition. Itri and itrix means speciality. Here there is I here, speciality or medical treatment. When we say ian or ist, means specialist. And as means structure. Logy means study of, like dermatology, cardiology. These suffixes, they means pertaining to. What is the meaning of pertaining to? Pertaining to means related to. Pertaining to means related to. Related to. So when I say, for example, pertaining to the heart, means related to the heart. All right. Some suffixes refer to tests and procedures, like surgery, for example. So, plasty means surgical repair. Ectomy means removal of, like nephrectomy means removal of the kidney. Gram means image or record. Like the word that we have taken before, electroencephalogram. We have oraphy means suture or stitching. Suture means surgery. Suture means surgery. Otomy means cutting into or incision. Scopy means viewing. Arthropathy means crushing or destroying. Stomy means opening. Some suffixes refer to pathology or function, like inia means blood. Site means cell. Algia means pain. And tinea means breathing. Itis means inflammation. Osis means condition or disease. Penia means deficiency. Pathy means disease, like enteropathy means a disease of the intestines. Rag means excessive flow. Ragia means excessive flow. Oma means mass or tumor, like hepatoma. Cissus means separation or splitting. Plegia means condition of paralysis, like when I say diplegia means paralysis on both sides. Paralysis on both sides, on two sides, because di means two. Leth means stone. So now we have taken the main roots, prefixes, and suffixes that you may see in your study. Of course, there are many of them, but we have taken the ones that you can see a lot. So let's move to some examples. For example, a word like dermatitis. Derma, we said that the root derma means skin, and itis, dermat means skin, and itis means inflammation. So when I say dermatitis means inflammation of the skin. We have colostomy. Colo means colon, and stomy or ostomy means opening of. So colostomy is creating an opening in the colon. The third example, transesophageal. We have transesophageal. Trans means across, esophage related to esophagus, and il means condition, means pertaining to or related to. So transesophageal means a test that involves going through the throat. Other examples, we have carditis. Here we have cardio alone means heart, and itis means inflammation. So carditis means inflammation of the heart. We have cardiology. As we said, cardio means heart and logy means study. So it's the study of the heart. We have cardiomyopathy. This long word, it consists of two roots. Cardio means heart, myo means muscles, and pathy means disease. So it's the disease of heart and muscles. The disease of heart muscle. Echocardiography. Echocardiography here, echo means waves, ultrasonic waves. Cardio means heart, and graphy means picture. Colitis. Here, words that have the root colon, colo. The root colo meaning colon. We have colitis means inflammation of the colon. We have colectomy means removal of the colon. And we have colonoscopy means the view of the colon. All right, again, when we have, for example, here, in these medical terms that we will have, we will find the root itis. And we said that itis means inflammation. So when I say, for example, hepatitis, this means the inflammation of the liver. Pneumonitis means the inflammation of the lungs. Gastritis means inflammation of the stomach. Encephalitis means inflammation of the brain. Otitis means inflammation of the ear. All right, so you can understand as many medical terms by dividing this medical terms into prefix, root, and suffix. All right, and these are other examples. Okay, before taking some questions, I'll have some questions with you and we will answer it together in order to make sure that you memorize and you understand the prefix, root, and suffix that we have taken. But before this, I want to revise what we have taken, and I revise it in Arabic and in English because I'm not sure about your level in English and if you understand or not, because of course this is not an interactive lecture, it's just narrated lecture. So I'll speak in Arabic in order to make sure that you all understand. So again, This lecture was about understanding the medical terminologies. المحاضرة دي كانت عن فهم المصطلحات الطبية. And it was mainly about your ability to understand the medical terminologies by dividing them. وكانت عن مقدرتكم على ان انتوا تفهموا اكبر كم ممكن من المصطلحات العلميه عن الطبيه عن طريق تقسيم المصطلحات دي ل prefix root and suffix بدايه وميدل ووسط ونهايه. البدايه اسمها prefix والوسط اسمه root والنهايه اسمها suffix. We have taken the meaning of these prefix roots and suffix. أخذنا معنى البريفكس. قلنا البريفكس ممكن يدل على لون، يدل على مكان، يدل على again let me remember with you and the types of the prefix. Yes ممكن يدل على time أو or speed، يعني على وقت أو على سرعة زي ما بنقول قبل بعد وهكذا. ممكن يدل على position أو direction. فالمطلوب منكم إن أنتوا تحفظوا مثلا البريفكس دول ومعناهم and the roots. قلنا أغلب الروتس بتدل على أعضاء في جسم الإنسان parts of the body parts. وقلنا السافكس ممكن يدل على مثلا عملية جراحية زي مثلا لما نقول إزالة أو فتح أو هكذا، أو ممكن يدل على أمراض معينة زي مثلا كلمة inflammation أو itis معناها تضخم وهكذا. فالمطلوب منكم إن أنتوا تحفظوا معاني الحاجات دي البريفكس والروت والسافكس. لما تحفظوا معانيها هتلاقوا إن أنتوا عندكم مقدرة على إن أنتوا تقسموا أغلب المصطلحات الطبية اللي هتشوفوها وتعرفوا بالتالي إن أنتوا تعرفوا معناها بسهولة. Now let's move to the assessment tasks. Match the affixes on the left to the meaning on the right. We have poly. Poly means many. We have protho. Protho means addition of artificial part. We have regia means condition of excessive flow of blood. We have raphi means suture or stitching. And we have scissus means means splitting. Nephritis means inflammation of the kidney. As we said, nephro means kidney. What is the other root that means kidney? Ren. Okay. Which of the following Greek words means pain? The answer will be number A. Geriatrics means a branch of medicine concerned with the old age. As we said, gero means old age. The word paralgia refers to which part of the body? Refers to the ankle. Refers to the ankle. Which of the following suffixes refers to a disease or disorder? The answer will be number A. Osis means disease or condition. Matching between the first column and the second column. Periton means number E. Membrane lining of abdomen and pelvis. Let's move to the second question, hypervolemia. Here, let's divide it. Hyper means all right. Hyper means high. Vol comes from volume. Emia means blood, and ya means condition. So it is the condition of having high or increased blood volume. So the answer will be number E, abnormal increase in blood volume. Okay, let's see this. Hypoxemia, all right? So hypo means low, ox means oxygen, emia, mu means blood, and ya means condition. So it's the condition of having low oxygen in the blood. So the answer will be number D, blood oxygen deficiency. All right, number 3, vasculitis. As we said, vasculo means blood vessels and itis means inflammation. So the answer will be blood vessel inflammation. Number 4, bacteremia. We have bactero means bacteria, and emia, mu means blood, and ya means condition. So it's the condition of having bacteria in the blood. The answer will be number A. Toxemia means toxo means poison. So the answer will be number C, blood poisoning. So I leave you answer this task. Again, as I told you, I want you, like esophagoscope, I want you to divide the word esophago means esophagus, and scope means instrument view. So for example, number B will be the answer. So I want you in the next medical terminologies to divide the word into the root esophago and the suffix and see the meaning of the suffix. All right, number 2, we have colo, means part of the small intestine. We have lebi, means lip. We have buck, means cheek. We have ren, means kidney. And we have gastro, means stomach. Task 2, page 15, the last page. Number 1, colon pertains to part of the small intestine. Number 2, labi or labio, refers to number E, lip. Number 3, buccal, refers to number B, cheek. Number 4, ren, refers to number A, kidney. Number 5, gastro, refers to stomach, number C. Task 3, periton, refers to number A, membrane lining the abdominal cavities. Number 2, hepato, refers to liver. Nephro refers to kidney. Rect refers to rectum. Lingo refers to tongue. Task 4, introscope. The prefix intro refers to the intestines. And scope, the suffix scope, refers to instrument view. So introscope, the answer is number A, instrument to view the intestine. Number 2, endoscope. The prefix endo means within, as we said. So endoscope refers to instrument to view body cavities. Number 3, endoscopy. Endoscopy refers to number E, visual examination of the body cavities. Enteroscopy, number 4, refers to visual examination of the intestines. Number 5, endoscopist refers to number B, person who operates an instrument for examining the body cavities. So here, although the two words, they are very similar in the spelling, but they have two different meanings, and you can differentiate between these two meanings by knowing the meaning of the prefix intro and endo. Intro means intestines, and endo means within, and also between scope and scopy. Scope is the instrument itself, and scopy is the noun, it's the visual examination. And scopist is the person who operates an instrument, is the specialist in himself or herself. Okay, this is for our lecture today about medical terminology. As I told you in the beginning of the lecture, you will use these medical terminologies throughout your study, and we will use it also throughout our course. See you next time, guys, in the second lecture.